In the United States, non-alcoholic fatty liver disease, NAFLD, is one of the leading causes of liver disease. It is a disorder in which the liver stores excess fat, which, if left untreated, can progress to cirrhosis and liver failure. Adults who are overweight or have type 2 diabetes are more likely to have NAFLD. Unlike alcohol-related liver disease, NAFLD is not caused by drinking too much alcohol. In a healthy body, the liver eliminates toxins and excretes bile, a protein that degrades fat into digestible fatty acids. Fatty liver disease, which destroys the liver and makes it less able to work normally, can be stopped from getting worse by making changes to how you live. Through a mix of calorie restriction, exercise, and healthy eating, weight loss is the first-line treatment for NAFLD. Non-alcoholic fatty liver disease. Include these things in your diet for a healthy liver. Number 1. Eating nuts can help reduce inflammation in the body. A lower prevalence of non-alcoholic fatty liver disease, NAFLD, is connected with eating a diet that is high in nuts because eating nuts is associated with lower levels of inflammation, insulin resistance, and oxidative stress. Researchers have found that eating walnuts is linked to better liver function tests in people with fatty liver disease. In addition, a large study done in China found that eating more nuts was strongly linked to a lower risk of non-alcoholic fatty liver disease, NAFLD. Number 2. Eating fish lowers levels of inflammation and fat in the body. Omega-3 fatty acids can be found in high concentrations in fatty fish, including salmon, sardines, tuna, and trout. According to research, taking omega-3 fatty acid supplements may help people who have NAFLD by reducing the amount of fat in the liver, increasing the amount of healthy HDL cholesterol, and bringing down triglyceride levels. Number 3. The use of turmeric has been shown to lower signs of liver damage. People who have NAFLD and take large amounts of curcumin, which is the active component in turmeric, may have lower levels of some markers of liver damage. Studies on turmeric supplementation have discovered that the bright orange root may lower serum alanine aminotransferase, ALT, and aspartate aminotransferase, AST, levels. These are two enzymes whose levels are usually high in people who have fatty liver disease. Number 4. Oatmeal, which is high in fiber. Oatmeal and other foods that are high in fiber and whole grains are associated with a lower risk of illness that are related to NAFLD. Studies have indicated that patients who suffer from NAFLD can benefit from a healthy diet that is high in foods that are high in fiber, such as oats, and that this diet may also help reduce triglyceride levels. Number 5. Leafy greens help prevent the accumulation of fat. There is some evidence to suggest that particular chemicals that are found in spinach and other leafy greens may be of assistance in the fight against fatty liver disease. A study conducted in 2021 discovered that eating spinach especially reduced the likelihood of developing NAFLD. This reduction in risk may be attributable to the nitrate and unique polyphenols that are present in the leafy green. Curiously, the research concentrated on uncooked spinach due to the fact that the cooked kind did not produce nearly as impressive outcomes. This can be due to the fact that boiling spinach and other leafy greens might reduce the amount of polyphenolic content and antioxidant activity in the food. Number 6. Coffee can help reduce abnormal levels of liver enzymes. It's possible that the coffee you drink every morning can help prevent NAFLD from developing in your liver. A study done in 2021 found that people who drink coffee regularly have a lower chance of having non-alcoholic fatty liver disease, NAFLD, and that people who already have NAFLD are less likely to have their liver fibrosis get worse. It also seems that caffeine can reduce the amount of apparent liver enzymes in people who are at high risk for developing liver illnesses. Number 7. Consume more beans and soy to lower your risk of developing NAFLD. Beans and soy have shown promise in decreasing NAFLD risk. A study on diet and liver disease found that legumes such as lentils, chickpeas, soybeans, and peas are abundant in nutrients that include resistant starches that are good for the digestive tract. Beans may help obese people lower their blood glucose and cholesterol levels. A 2019 study indicated that consuming legumes can reduce NAFLD risk. Miso soup, which contains fermented soy, or soy in place of meat or fish, may also benefit liver function. Soy has a lot of the protein conglycinin, which helps lower triglyceride levels and keeps visceral fat from building up. Tofu is low in fat and high in protein, so it's a good choice for reducing fat intake. Bottom line, non-alcoholic fatty liver disease, NAFLD, is one of the causes of liver problems. Adults who are overweight or have type 2 diabetes are more likely to have NAFLD. Eating nuts can help reduce inflammation in the body. The use of turmeric has been shown to lower signs of liver damage. Non-alcoholic fatty liver disease, NAFLD, is linked to a lower chance of getting sick. Foods high in fiber and whole grains, like oatmeal, are linked to a lower chance of getting sick. Coffee can help reduce abnormal levels of liver enzymes. Consuming more beans and soy can help decrease the risk of developing NAFLD. Which of these things would you like to add to your diet? Comment with your answer below. For more health tips, please subscribe to Our Daily Health.